When every second counts, nothing should stand in the way of saving lives. The highly trained teams of healthcare professionals who work here can perform miracles, but they need both the tools and the reliable communication systems that make those miracles possible. Life hangs in the balance on a daily basis here in the operating rooms. But finding ways to balance the budgets of these complex facilities is critical so that the hospital's economic resources can be maximized for patient care and minimized for support systems. The University Health Network's enterprise communication strategy, enabled by GlobeStar Systems, provides an integration solution that is a vital part of both the operating rooms and patient services here at Toronto General Hospital.
First of all, we had to build an infrastructure for the phones and the computers, etc., to communicate. That anytime there's a request for a particular service, that message is quickly sent to whoever is appropriate.
There can be up to 19 rooms running during the daytime, and then you have to be ready for emergencies that can come from anywhere in the hospital.
Operating room time is the most expensive real estate in any hospital, and with the waiting list growing for all patients, it was our duty to patients to ensure that we maximized our utilization and maintained the best flexibility possible.
And part of the initial assessment in Betty Watt's team was to figure out what it was costing them per minute not to have that room utilized. And it was about $128 per minute. Furthermore, if you look at the average pager response, probably 3 to 5 minutes. And if you do the math there, it adds up very quickly.
We had twice the square feet that we had in the previous operating rooms, and I wasn't going to get any more money for the patients, for staff, for cleaning, for nursing, so I had to be more efficient. So for the communication system, we had to have something that was nurse-friendly, that was user-friendly, that was great for patients.
Our new unit is decentralized, and the nurses actually sit at 3 different nursing stations. And our telemetry monitoring nurse is in a separate room. So it created a lot of communication difficulties that we didn't have in a centralized concept.
The future of surgery is very unpredictable. Nobody's sure what the future holds for us. So we wanted to be very flexible.
Regardless of the technical complexity of any solution, the greatest challenge is to make all of its functions simple, easily accessible, and intuitive for the users.
One of the core tenets of the software was to design a system that was very easy to use, one that would be intuitive for the users to reflect the reality in which they live day to day. Ostensibly, the Connexall application is a software-based translator that brings all of the disparate elements of the environment here in the OR and at TGH in general together to provide a comprehensive notification management solution. A lot of words that basically mean simplifying the delivery of information to caregivers and to staff. So icons and pictures are used to really represent what the staff are familiar with day to day.
Some solutions are designed so that the workflow has to be tailored to the system, and you would argue that's not a solution. In this case, the GlobeStar software and all the other components are designed so that they're very flexible and they can change.
Again, a key tenet of the software is that regardless of the device the individual happens to be carrying, regardless of the system that is generating the information that they need to see, connecting the dots, assigning, is just a simple drag and drop operation. So there is no new system to learn.
It even looks appropriate on the screen for what they want to do. They don't have to think about it. They click away, and they know in sub-second type communications that whoever they want to talk to is getting the message. And they'll know shortly after that that the message has been acknowledged. And then they can go on to the next thing that they have to do, and knowing that that job's going to get done.
The Connexall application also allows the user to decide how they want to escalate a call in the event that a message is not acknowledged within a specified time. If the first recipient is busy or their phone is turned off, the call will automatically go to the next available person on the list.
So that flexibility has really helped us, and it's helped us design some new workflow solutions that to be honest, we hadn't even thought of before we opened this place.
In the OR area, seconds often make the difference between life and death.
I'll tell you what I tell everybody when they come through their tour. What I like the best of the system, and it happens every other day at least, the button on the wall is pressed, I get a phone call, and in 10 seconds you have 8 people, and we all go and we aid and we know what to do right away in the case, and we can help.
Because of the time-saving component, with the communication system, we've been able to actually save lives.
It's like sports. You don't want the player to have to think about some of those smaller details. You want he or she just to be able to play the game. And although this is anything but a game, the solution allows them to work seamlessly without having to slow down and think about what they have to do to call for assistance.
The techie people know the technology. We, the end user, know the needs. And I think it was the marriage between the end user and the technology people that has given us the perfect product.
On each of the patient floors, the nurse call system has been incorporated so that a patient call is immediately directed to the wireless telephones carried by the nursing staff.
We as a group of people are always fatigued because we work long hours and there's a lot of demands on us. But certainly this system allows nurses to save steps because they can talk directly to the patient, find out what they need, and then go to the room. You can also prioritize your work because someone may call with a simple need like, next time you're down, could you bring such and such, and you don't really need to attend to it right away. You can really do it the next time you're down that way. The actual noise in the nursing station is much less too because our receptionist takes all incoming calls at the reception desk and dispatches them on to the small telephones of each individual nurse. So the nursing station itself does not have a lot of ringing telephones. We also ask the receptionist to stop overhead paging for anything. The benefits of a quieter environment are very important for patients, and really, rest is one of the things that helps promote wellness.
The Toronto General Hospital's development team created a vision for a communication system that would not only fulfill all of their current requirements, but also be continuously adaptable to the ever-changing healthcare environment. GlobeStar Systems is proud to have been a part of this highly successful project.
Everyone's comfort level, the care and safety of the patient, the coordination of the cases, the adaptability and flexibility and opportunity for emergencies. It's awesome.
It's become an integral part of the way they do business, and that's the best thing you want from a solution, to become part of the business.
It's funny how life is that way. You get along without it for 100 years, and once you have it and are comfortable working with it, you can't live without it. And I would say that's a very true statement.
I can't imagine not having it anymore.